there, welcome back to my YouTube channel. Today we are just going to be talking about your natural versus your cesarean section modes of delivery. If you are new to my channel, welcome to my channel. This is Dr. NAMBI, medical doctor by profession. So I'm just giving you advices and tips and also some, a bit of education so you are informed about, when it's time to give birth, what mode of delivery is suitable for you, so that you don't go in and then you look surprised at the choices that are being offered to you. And also, if you are new to my channel, please don't forget to like, subscribe and follow my journey as I continue to inspire you and share my wisdom on things that I know will add value to your life. So let's start by looking at the comparison between natural versus your cesarean or C-section, as I will call it in this video. So with natural is usually when you give birth naturally without being assisted. So basically you go in labor, you have contractions, you have the 3 stages in labor. So from your active labor contractions or active phase of labor to the delivery of the baby, from the delivery of the baby to the delivery of the placenta. So this, unfortunately, for some women, because of some or certain complications, they are unable to go through the natural delivery, and then we convert from natural delivery into your cesarean section. Cesarean is just when an incision or a cut is made on the lower abdomen, and then through that cut they are able to deliver the baby. So you as a woman, you actually don't go into labor, they book you. It can be either an elective cesarean or in some cases whereby in case of an emergency, so let's say you were in a natural birth, but because of complications, to save your life or the life of the baby, they convert from natural into a cesarean section. So that is an emergency cesarean section that will happen within probably the doctor will make a call within 30 plus or 30 plus minutes. Depends on the complication, depends on how ready is your theater, how ready is the staff from the doctors, the nurses that work in theater, and all the staffs that are needed in order to make sure that you've been transported to the area where you need to be operated as soon as possible. So yes, that is basically about it. So natural, you deliver naturally without really much of an assistance, and then with cesarean you actually get assisted. So they cut, you don't go into labor most of the times, but some they go into labor, but due to some unforeseen circumstance, the baby is not coming, so the doctors will help by delivering the baby. So I have the pleasure of experiencing both. I had a natural birth and I also had a cesarean section. So because of that, I am able to talk from both sides, the pros, the cons, and what is good, what is bad with both of these methods. So the tips I will give you, some are personally from what I experienced, some is what I've experienced also as a medical doctor, not just as a patient, so that you are informed when you are pregnant and you are thinking of what is the way to deliver, you know where you stand. So let's go to the comparison. So when it comes to your natural delivery, most of the times, you have a shorter, number one, shorter hospital stay. Usually most hospitals that I know of, they won't keep a woman, let's say, more than 48 hours. Most of the women are kept there for a maximum of 24 hours. If especially the baby has passed meconium, not meconium, the first stools. So if the baby has passed the first stools after delivery, then also that helps you so that at least you get discharged very early. So the baby has to pass the first stools, and then if the response, no complications, then your stay in hospital will even be extremely shorter than 24 hours. On the other hand, if you are having an operation or cesarean section, usually the maximum stay is 72 hours, which is 3 days, provided there's no complication. We have had women that have had complications. In those instances, you can take more than 48 hours because either, let's say, maybe during the operation you lost a lot of blood, so they still need to keep you further, or other complications that may arise, so they might keep you longer than the 3 days. But typically they keep you for at least 3 days. So the other one, natural, 6 hours, maximum up to 24 hours, depends on the stools that the baby has passed, and also how the baby is doing. Are the lungs okay? Any complications, especially respiratory, cardiac complication, or heart complications? If there's no complications, then you are most likely to be discharged earlier. So that is number one on the comparison. Number two, the healing process with your natural birth is very fast, because most of the times, I know women, and even myself personally, I had to have an episiotomy. So episiotomy is just a cut, especially when the baby's head is coming, and if the exit point is too small, what they will do, they will just have a small cut on the side of the vagina just to assist, so that the baby can be able to have enough space for that head to come out. So, but even with that cut, most of the times the healing process is very fast. With your cesarean section, because the cut is a longer cut, that can be up to between, let's say 10 to 15 or even 20 centimeter long. So that cut can actually take, longer to heal. The layers that you have to go through, before you reach the baby, there are a lot of layers. So that also internally, it can take longer to heal compared to your natural birth. So the healing process also is affected, that, with your natural, you heal faster, but with your operation, it takes very long before you heal. The other point is, with your natural, immediately after the baby has been delivered, while they're waiting for the placenta to be delivered, it's easy for, the doctors to just place already the baby with the mother. So you have early bonding time between the mother and the baby. While with your operation, usually the bonding time is actually, it can take longer, because imagine if, the woman is complicating, she's having anesthetic complications. Unfortunately, they have to save the life instead of, giving that mother to child or mother to baby bonding time. So that also can actually be affected. So also with your natural, complications are lesser. But we've seen, especially as you get older, most women suffer from urinary incontinence, prolapse, of your organs. So let's say the bladder can prolapse because of a weaker pelvic muscles, or pelvic muscles, and so that can actually affect. So the womb can also come out, the bladder can come out, because of that pelvic floor muscles are actually weak. While with your operation, because you're not gonna go through that trauma of pushing down the baby down through the pelvic floor, so you don't actually experience a lot of urinary incontinence, or organ prolapse like your bladder or your uterine prolapse, because most of the times, your pelvic is intact, is not affected. So that is it. And then, so also what I've seen personally, with your natural, the pain is usually too much at the beginning because of the labor pains. The active phase of labor is very painful. So it's not everybody who can stand that. So that can be very painful. But with your cesarean or your operation, the pain is most of the times not there initially, but towards the end, as you are healing, the pain is actually coming back gradually as the anesthesia wears out of your system. All right, so that is the comparison between natural versus, cesarean section mode of delivery of a baby. So let me quickly go into what are the indications for a woman to be, for the doctor to make the decision to say, okay, let me turn this, or let me put this woman and book this woman for an elective or an emergency cesarean section. So commonly, the main reasons the doctor will convert, especially for baby, if it's a big baby, we know women who are diabetic usually give birth to very big baby, up to more than 4 kilos. So that is actually extremely big. So so that actually makes that woman might not be able to, deliver properly. So they will, book that woman for, an elective, cesarean, because of the high risk that, the labor can actually complicate. So big baby is one of the indication. In the baby also, especially we call it, medical terms, we call it fetal distress. Fetal distress is whereby, let's say the woman has been in labor, and then where we chart to check, the progress of, the heart rate, the heartbeat of the baby, you start to notice that the baby's heart rate is actually decreasing and going down and down and down. That is a sign that, you need to monitor closely. If it crosses at one of, the points, we know already this is a cut-off line. This woman must, this baby must be delivered. Otherwise, there's a risk that that baby will be lost. So that one we make, how we know is there's a thing they put here, to monitor the heart rate of the baby. And also it charts. So the chart that we follow is a pathogram. So I just don't have it, so I can't show you what a pathogram looks like. But if you've been in labor before, you will see a machine that looks almost like a printer, but it's printing out, and you have like graphs. So that's what we call a pathogram that you use to chart a woman. So the nurses usually do it. If they pick up like here, either the heart rate is not doing very well, or the contractions are not good enough, they get to inform the doctor, so the doctor can prescribe and, or intervene and make the necessary call for an operation or not. So those are the most likely causes of, baby reasons why they want to operate you. So fetal distress, big baby. Maternal factors that can lead you to, let's say, have an operation, especially if you are very small, you have a small pelvis. So especially if you are also having a big baby, so the chances that that baby will pass on a small pelvis is very slim. So they will convert it into an operation so that they can be able to allow the baby to be able to pass instead of, having complications because, the baby can't pass through, a very, very, small pelvis. So that is number one on maternal. Number two on maternal factors that can lead for a woman or a mother to be, turned into an operation, especially with your chronic illnesses, like I spoke, diabetes. Most diabetic women end up with big babies. So they will keep monitoring you during the process of pregnancy. But once they pick up that, this baby is actually very big, there's a high chance they can convert it. Other chronic illnesses like your hypertension, we have what we call pregnancy-induced hypertension. So it's a hypertension that you develop when you are pregnant. Also, there's a high risk that, the baby can, complicate, the mother can complicate. So, and both might or can end up in the ICU. So because of that, also there's a high chance that if your high blood pressure is uncontrolled and you are, especially with developing complications, liver, multiple organ failure, they are also going to convert it into an operation. We have women also that have come with genital, let's say, warts. But some doctors will still allow, the woman can give birth naturally. But for some, they will just say, what, the warts are just too big and they are obstructing or they are blocking, the baby can't come, so they will take the baby out through operation. HIV, it's debatable with these days, especially with your antiretroviral. If the woman is able to take a treatment, viral load is undetectable. I know some hospitals that still allow women to give birth naturally, but some will just already opt for, operation to reduce the risk or the chances of the baby getting HIV through the birth canal. So yeah, so that can also be one of the reasons that they can say, okay, let's do an operation, especially on maternal factors. The other maternal factor, especially if there's poor progress in labor. So let's say the woman came in labor and it's more than 24 hours, more than 48 hours, and that chart or that graph I'm talking about is showing the contractions are very poor, the progress is already very poor, and there's a line of action, is already crossing over the line of action. That is a point to say, what, this is a time to act, so acting by probably going for operation because the labor is very poor. So in that instances, the doctor will opt now to do the, to do the operation. The other factors we've seen, so if you are a woman, you've had, let's say, natural birth, then the second baby, you have an operation. There's a high chance they will again do an operation. The indication is because of previous operation. These days, I've seen personally that, especially if you've had natural first and then you went for operation, there's a high chance you're going to go back again for operation. So there's this thing they call VBAC, so vaginal birth delivery after cesarean. So sometimes it happens, but they allow it, especially if, the gynae or the doctor, is very confident that they can be able to handle the complications that arise with, giving birth naturally after having a cesarean section. Most will not take the risk because, a lot of things can happen. A woman can bleed severely and lose a lot of blood through that whole process. And the woman can have an atonic uterus, so uterus doesn't want to contract and come back, to normal. So a lot of complications can arise, during, that process. So most doctors would rather just go straight and they will do your operation. So if you are pregnant, if you are expecting a baby, I hope this information does help you. Please feel free to discuss with your gynae, also discuss with your midwife or whoever is helping to deliver you so that you understand. Sometimes patients just go to doctors and then you are told, okay, do this and this, and then you just keep quiet and then you come home, you ask all these questions. So remember, it's your body. Before we are even able to do anything, especially as doctor, everything has to be authorized through a consent form. So consent form, you give us permission to do what we need to do or to do our job, except in a case of an emergency where we can't reach, where you can't make that decision, or your family is too far to make that decision. Then we will make that decision through the hospital superintendent. Then we can sign on your behalf and convert from natural to emergency operation. So while you have the time, especially if you are pregnant, if you are expecting a baby, please do your research, find out what you need to equip yourself, how to be ready for the birth of your precious baby, and don't be afraid to ask your doctor to explain all these things that I'm telling you now, so that you are aware. And it's not every time that you go in, let's say a cesarean, that it turns out as a horrible story. I know a lot of successful stories whereby people went, including myself. I went for an operation and I survived, the baby survived, and minimal or less complications. And I also went for natural, and I had also minimal complications post-delivery. So make that informed, decision, so that you get to experience, a happy, mother-baby transition, so you don't have to develop, all these other complications that come, especially with a change in your body, change with the sleeping patterns, change with the new baby that has arrived in your life. So thank you so much. Please don't forget to like, to subscribe, and follow my channel. Dr. NAMBI signing out. Bye-bye.